Okay, we're on to protocol number 8. Thanks, Sam, for being so helpful here. Protocol 8, we're looking at cartilage, we're looking at tendons, we're looking at more fibrous things that have slower healing times, okay? So ligament, cartilage, and tendon. One of the big places you see rotator cuff, but knees, boy, there can't be, more people with knees out there, especially as we get older. So this is one of the reasons that I really enjoy having a combination of red and infrared, because that infrared really can get in there deeper, creates a little bit more of a heat sensation, increases circulation with the combination of red. So again, that combination is really great because I get both the effects of both the red and the infrared. So we're going to start with the infrared for 60 seconds. And we're going to come right into the knee area, okay? So you can come both sides. I can tell you you're going to get lateral, but most people are going to have more medial knee pain because the vastus medialis tracks here, we get trauma, the adductors turn off, and this pump leaves the lymphatics in here, so we get a combination of mechanical pain as we start to compress the joints. And then we also get the chemical pain as a consequence of lactic acid and other buildup that sits in the lymphatics. So 60 seconds and then 120 seconds of red. Like I say, if you get the program, you give me a call. We'll get you a laser, gets this all programmed, and you won't even have to worry about it. So if you had only red, you can use red. If you had only infrared, you can do it. If you had a combination, then you're going to get the best of both worlds, okay? So infrared to begin with, and then a red. So you can see pretty much a pattern where most of the time, not all the time, I like to start with an infrared, and then I bring more blood supply to the area, and then I follow it up with the red. But you can bounce around a little bit. Certain protocols I like to finish with infrared. So right on the area, again, I could be doing some tapping, but more in this situation, I'm not going to be doing too much activation because I'm trying to repair the area, so I don't want to be doing too much. Works great in a combination with other things. If I want to do some microcurrent here, where I'm sending a signal, plus that bringing blood supply to the area, there's other things that I use. Sometimes I'll use like a reflexology machine that has a combination 10, so I'm firing the unit. So again, I'm setting the body, doing the nerve, I'm coming to the cartilage, and then I want to do activation. So the first 4 steps, all right? So we're going to continue here for about 3 minutes doing the outside of the knee. You would also maybe come into the inside of the knee, and at that point I would probably only do about 2 more minutes, so a total of 5 minutes in one area is about perfect. Now the laser has more of a bell curve, so you get good effect, and then you sort of plateau, and then it can drop off. But I find if you're staying underneath 5 minutes, you're really not going to have that drop off. I can usually sense it, having doing this for over 20 years, sort of when I max myself out. So sort of think of the cell as a sponge, right, or a battery. So if the battery's low or I have damage to this area, it's going to take a while to fill that up. But once my battery is full, or I put enough water or whatever in the sponge, I can't put any more in. So there's a maximum, right? So doing more doesn't help me. So usually I notice about 3 to 5 minutes is a good part for the cartilage, ligaments, and tendons. Sometimes I'll go longer in certain places, just depending on what I'm feeling and what we're sensing here. But again, ligament, cartilage, and tendon, this is a wonderful protocol to help people to repair cartilage. And there's great research on this cartilage repair as well. All right.